An AI chatbot just got the legal authority to prescribe psychiatric medication to real patients in the United States. No doctor, no appointment, no waiting room. Just you, your phone, and an algorithm deciding whether your antidepressants refilled. This is not a future scenario. It started this month. Here's what actually happened. Utah's Office of Artificial Intelligence Policy has approved a one-year pilot program allowing a San Francisco startup called Legion Health to operate an AI chatbot that renews psychiatric prescriptions without a physician being involved in the process. $19 a month. That's the subscription price. Fast, simple refills, the company says. The pilot launched in April 2026 and is currently taking waitlist sign-ups. The medications covered include Prozac, Zoloft, Wellbutrin, and hydroxyzine, drugs used to treat anxiety and depression. For millions of people, these are medications they take every day. And now, in Utah, an AI can decide to keep that prescription going. The program does have guardrails. The chatbot can only renew existing prescriptions. It cannot issue new ones. It's limited to 15 specific lower-risk maintenance medications. Patients must be considered stable. Anyone who had a dose change, a medication change, or a psychiatric hospitalization in the last year is excluded. And patients have to check in with a real healthcare provider every 10 refills or every 6 months. Controlled substances are completely off the table. No benzodiazepines, no antipsychotics, no lithium, no ADHD medications. So on paper, it's narrow. It's deliberately limited. It's a test. But here's what physicians are saying. Doctors are warning that the system is opaque, meaning they don't know how the AI makes its decisions. Mental health is notoriously complex. Someone who looks stable on paper can be in crisis. A patient's context changes: stress, life events, sleep, substance use, none of which shows up in a simple refill request to a chatbot. And the exclusion of more serious medications means this system will mostly serve people with mild to moderate conditions, not the people with the most severe mental health needs. The people who need the most help are the least likely to benefit. But here's the other side of the argument that you have to take seriously. There is a genuine mental health care shortage in the United States. Psychiatrists are overloaded. Appointments take weeks. People run out of medication because they can't get a follow-up fast enough. If an AI can safely handle routine refills for stable patients, freeing up doctors to spend their time on complex cases, that might actually be a good thing. The question is, who decides what counts as stable? And what happens when the algorithm gets it wrong? This is the second time Utah has delegated clinical authority to an AI. The first was a different program, and now they're expanding the experiment. Other states are watching. If this pilot goes well, it won't stay in Utah. We are watching AI move from answering questions to making medical decisions in real time. The speed of this shift is what's striking. A year ago, this would have seemed like science fiction. Today, it's a $19 subscription. Whether that's progress or something we're going to regret, we're about to find out.